Hello everybody and welcome back. I'm starting a YouTube channel, guys. This is an exciting step for me, and I promise you that I will populate it with the best content, with the best sources for your viewing pleasure and to improve your dental health, because that's in the end what this is all about. Today I have a couple of really good questions from skincare blogger. She also has a really cool profile, you should check her out. Can you tell by looking at a celebrity if their teeth are real or veneers? The post that I did previously about Susie's veneers, I think that message is really important. Veneers are whatever you want them to be. If they're done really well, fake or real or too white or too discolored, it's all the choice of the client. So it doesn't become a question of, does this dentist do real or fake veneers? It becomes a question of, does this dentist understand their clients to the degree that they can bring out their inner desires? And they can be based on, for example, you grew up as a kid, and for me personally, I used to have a gap between my front teeth, and that really affected the way that I perceived myself. For you, you have, I don't know, your canine teeth are really pointy, and that affects you day to day because every time you look in the mirror, you go, oh, I look like a vampire. Or you drank heaps of soft drinks when you were a teenager and your teeth are really worn flat, or they're a little bit yellow and you can't do anything to whiten them. That will affect what you want as your result. If your teeth have always been yellow, then the result that you want is probably whiter than someone who's always had relatively white teeth. Not because there's a difference in what they want, just because in the past, there have been other things that will affect their perception of the result. And that's what I'm about. We find out what is deep inside, what you really want out of your smile and out of your facial aesthetics, and that's what we strive for. So the short answer is, if a celebrity had well done veneers, then no. Me nor anyone else should be able to tell whether they've had veneers or not. But if they've, for example, had them done well, this is a caveat, and they requested that the teeth be BL1, which is the lightest shade of porcelain that you can get, which is almost paper. Like literally, it's whiter than my walls, which are Dulux Vivid White. And there's nothing wrong with that. If that's what the client wants, and that's what the client wants. Where we come to problems is because the client has been looking at pictures of celebrities their whole lives, and the celebrities follow a fashion. Unfortunately, fashion, I'm sure you've heard that said, style never changes, fashion does. So if we find your style, that's just you. That's the best that your smile and your face can be. If we just run after what you've been influenced to believe is the best thing for you, because, forgive me, you probably spend a bit too much time on social media, then we're going to get a result that you may be happy with for a couple of weeks. Give it a few months, a year. These things are supposed to last for 10 years. What's going to happen in a decade? That's what needs to be thought about before you start thinking about high-end dental cosmetics. Question number 2. Why are some veneers done in porcelain and some in composite? Is it purely down to cost? Now, I'm going to run along the line of what I've been talking about before. Ultra high-end cosmetics, porcelain veneers fall very well within that category. They need to be done to the highest level feasible. There are other factors that can affect whether or not you can afford high-end cosmetics or whether or not it's good for you. For example, say you're 19 years old. You want a perfect smile because you had all these problems as a kid. Unfortunately, porcelain veneers comes at what we call a biological cost. So I've got to cut away some of your enamel and replace it with porcelain so that they don't look all horsey and massive. If we do this strategically, I look at your teeth and your age and all of the other factors that will affect your ability to enjoy this smile. This 19-year-old patient, this 20-year-old patient, it's all circumstantial. If a 19-year-old has teeth that have been destroyed by whatever, or they've been born with teeth that are discolored, then yes, porcelain veneers are the best option for them. But composite veneers, and the beauty of the composite veneer procedure in general, is that it's just so customizable. If you come in and you're like, I just hate I don't know exactly what I want, but I hate my smile, please help me do something about it, then I say, okay. And the things that we spend all of our time talking about are how to maintain them really well, how to look after your teeth and gums so that they don't deteriorate, and how to make sure that they don't stain over time, because you'll find that composite veneers objectively will stain much more than porcelain. At the end of, and this is in general the plan for almost everyone who has composite veneers. We can replace them every 5 years, and that's perfectly fine, but at one point in time, you'll come and say, Rick, you know what? I love them. This is it. I've had them for a couple of years. There's nothing else I want to change. This is the one. Beautiful. Scan your teeth, do them in porcelain. Happy days.